So today in this video, I'm going to show you why is there a need for nasal washes and douching from both the patient side and the surgeon side after a FESS surgery. Now, as you can see, this is a patient's left nasal cavity. You can see a lot of sticky yellowish green mucoid secretion. You can see the inferior turbinate, a small synecdoche down there, and as we go up there, you can see a complete blockage in the upper half of the nasal cavity. You can see a small hole in the nasal septum. Now, I have decongested the inferior turbinate with the Otriven nasal drop. So before decongestion, it was completely choked up. Hence, it was also giving a lot of nasal blockage. You can see that's the choana region. The patient is swallowing right now, and you can see a lot of uh, secretion buildup right there. That is coming from the maxillary sinus, the ethmoids, and the sphenoid sinus, assuming because that's the direction of the flow. You can see the upper half of the nasal cavity that belongs to the ethmoid sinus, the cribriform plate, the place where the receptors of smell are. So this patient has at present complete anosmia. You can see that's the patient's right side, and the superior half of the nasal cavity is completely blocked off with all the secretions and buildup of polypoidal tissue again. So this patient was operated for the reason of bilateral nasal polyposis 6 years back by me when I was a resident in my second year, and the patient did not have any complaints whatsoever after that. Recently, 3-4 months back, he started having the same problem, little bit of recurrence of polyps, but he got operated at a place somewhere else. And this is immediately after the surgery, what I'm showing you right now, like a month or so. So the patient and the surgeon did not have any follow-up whatsoever, and no nasal washes, no budesonide washes, no nasal douching whatsoever, and this is a result of that. So that is why after a surgery of FESS, the patient needs to come for a follow-up routine and get the nasal washes done. Proper follow-up will not cause any of this. So I'll be planning this patient surgery again, and this time I'll be doing a complete full house FESS. Along with, I'll be using a Paul Casanova flap to repair the anterior small perforation in the septum, and I'll be also performing the bilateral turbinate reduction the way I normally do. So this patient won't have any complaints whatsoever in future.